Welcome everyone to our CoolSculpting webinar. Thank you so much for joining us. My name is Hillary Lébo Schaefer. I'm one of the owners here at Lébo Aesthetics and Spa. I'm also a medical esthetician that performs the CoolSculpting procedure. So CoolSculpting freezes fat. So it takes this pocket of fat that you have, draws it into this little device, and through a very protected cooling system, it freezes the fat, and you lose about 20 to 25% of the fat cells in that area, and they completely disappear. They don't return. So it's amazing for those pockets. Why do we bring it into the practice? Because who doesn't have a little bit of where we can pinch an inch and want to treat it? It's wonderful for that. So I think it's a great complement to our practice because we can really sculpt a body and remove fat that is just stubborn and unwanted. So how is CoolSculpting different than similar treatments? There really is nothing that's similar to CoolSculpting because of the way that it freezes the fat and protects the tissue around it. It is nice because, like, if somebody comes in and says, okay, what's the difference between liposuction versus CoolSculpting? Liposuction, it's a blind procedure. So yes, it can remove a lot of fat in one area, but it can also leave somebody that's smaller divoted because you can't see how much fat you're taking out. With this, because it's such a gradual fat loss, you don't get loose skin. It goes along with it. Now, if you already have loose skin beforehand, though, it's not necessarily going to change that. But if your skin's nice and you lose the fat, it won't make your skin loose. And it sometimes helps to tighten it as it goes away. So it's nice. It's just something totally different than what other treatments are like. Honestly, if you can pinch it, we can treat it. So anywhere that there are pockets of fat or areas that have fat, we just have to really be able to pinch it and draw it in. So as long as we can do that, it's treatable. Honestly, anyone, as long as you have a pocket of fat. So let's say you are on the GLP-1s, like the semaglutides or things like that, and you have lost weight, but there's an area that no matter what you've done, it just doesn't go away. Same thing if you're not on them and you exercise, you eat well, and this just one pocket, it could be here, it could be here, is not going away, we can treat it. On the other hand, if it's larger than a little pocket and it's kind of just an area that hangs over your jeans or under your bra, or you feel like you can visibly see it when you have like your t-shirt on, anything like that, we can treat. So everybody's a good candidate. We just have to be able to pinch that fat. Actually really isn't downtime with CoolSculpting. You could be a little bit achy afterwards, a little sensitive. I'll tell my patients, like, when the seatbelt goes across them, like, it might feel a little tender. Some people will say it's more of like an achy, dull feeling afterwards that they feel, but you could literally go to the gym right afterwards. Like, there's nothing that you need to avoid doing. It's more just what you're comfortable doing afterwards. And then the other question I often get is, when can you see results? Results do take, everybody's different. Usually in about 8 weeks, we start to see the results. Sometimes it's even a little bit sooner than that. But I usually tell everybody it's about 16 weeks when you get your full result. Hi, Heather. How are you?
Good. How are you?
Good. I'm Hillary. So tell me, what brings you in for CoolSculpting?
Well, I have lost some weight, but
Okay.
there are just a few areas that are still bothering me.
Okay.
So I really hate this fat above my knee here.
Okay.
So it, like, when I stand up, it like droops down and I just don't like it.
Okay.
So I wanted to see if there was something we could do.
Yep, absolutely. Can I pinch it really quick?
Oh, sure.
Thank you. Yep, so you do have some fat in there that I can definitely pinch, so you're a great candidate for CoolSculpting.
Okay.
Okay?
Great.
All right. Hi, everyone. Thank you so much for watching the webinar. I hope you learned a lot about CoolSculpting. So let me go through, you're welcome. Thank you. Let me go through some of these questions that I've gotten in so far. Are there any age or health restrictions? So they're really, you need to be 18 and over. So you have to be an adult to have it done. Health restrictions, I would say one of the biggest ones is if we need to do in front of the abdomen, you cannot have a hernia. That's one of the biggest ones that kind of causes the most problems. Other than that, it's kind of rare that there is something other than like if you have severe Raynaud's disease, because we do freeze the area. So you have sometimes some tendency to not do well with cold. Or if you're allergic to cold for some reason, there are people that are, then that would be something that we'd have to take into some consideration. If you're going through cancer treatments, chemo, anything that would be affecting your immune system, that would be something that we would talk about as well. We would want approval with your doctor, and they're probably not going to give it to you until you get through that. So those would kind of be just the biggest ones that I would say would make you not a candidate. So somebody had asked, how many treatments do you expect for the lower stomach area? This is what makes CoolSculpting hard. We need to see you because everybody's stomach is different and everybody's upper stomach or lower stomach. Some women have a very tiny upper and a larger lower, but that larger is larger for everybody differently. So we do free consultations. We are not pushy or pressuring at all. It's both Casey and I that do them. We're equally great. And that way we can really assess you and make sure that we're going to get you the results that you would want. Another question is, how close should a person be to their goal weight? Okay, so if someone is either in the process of losing weight, maybe they're on like one of the GLP-1s, like the semaglutides or something like that, or they're just, exercising and dieting. It really just depends, because let's say you are close to your goal weight, or maybe you have 20 pounds left to lose, but your stomach just really bothers you. Well, we can definitely just treat one area that's bothering you while you're losing weight. You will
it'll kind of give you a twofold because you're losing weight, but we're also removing the pocket of fat. So a lot of times patients like that do very well. Now, on the other hand, let's say you have 100 pounds to lose and you are looking at doing CoolSculpting all over. That's something that we'll talk about during that consultation. Depending on how large those pockets of fat are, it's more cycles that you might have to go through, or more like applicators that we have to put on, which sometimes can make the cost a little more. So you might find that you want to lose some more weight so that maybe it would be less treatments to go through if you have a lot to lose. But again, that's what the consultations are for, so that we can assess you. How long is each treatment? So each treatment does vary. So for example, let's say I'm doing someone's chin. So you have some people that come in and they only need one applicator right here on the center. You have other people that come in and they actually need 3 because the volume kind of extends back into here. So we might put like one here, and one underneath here. Well, each of those cycles takes 45 minutes. So that patient would be in for about 2.5 hours that they would be having their treatment done. On the other hand, let's say we're doing like the flanks, like kind of like back fat back here. We can do 2 of those applicators at a time, and they're 35 minutes a piece. So we would actually be doing about an hour, like an hour and a half they'd be in, and we'd get all of those cycles done. So it just depends on the body and what all we're kind of working on. Another question is, do you numb the area? We don't numb the area. We don't need to numb the area. It's not that uncomfortable. When we put the applicator on and we start the cooling process. So when I put the applicator on, you'll feel like a suctioning. Then when I start the cooling process, it'll feel cold and kind of burn a little bit, but not like burn like terrible. It's just kind of like a little bit of a stinging sensation. That will last for about 5 minutes. And then you'll be numb and won't really feel anything. Now, we didn't numb you. It's just the response to it being on there. So typically most patients say it's about 5 minutes and then they don't really feel anything. Can it help with sagging skin or just fat? That's a very common question, especially with people losing a lot of weight lately from all these different weight loss solutions and help that's out there. The CoolSculpting will never make you lose laxity, but if you've already lost the laxity and your skin's really hanging, CoolSculpting won't change that. It will only work on the fat that's there. So because it's such a gradual loss, the nicest part about CoolSculpting is it doesn't typically make you look loose at all. It just keeps on slowly losing that fat and your skin goes along with it. So it's a very nice response. And you could see some of that when those before and after pictures were going through. There was like a picture in the very beginning where the woman already had loose skin and we took that fat out. So that loose skin was still there, but we took the fat out. Where the other people all had, they didn't have that. And as they lost that fat, they didn't get loose skin. Let's see here. I'm on a GLP-1 and losing weight. When is the best time to do CoolSculpting? Somebody just had to ask that already. As far as, should you get to your goal weight or not? Again, that just depends. When you're losing weight, you typically aren't choosing where you're losing it from. So let's say, again, you have 20 pounds to lose and you just can't stand that pocket of the abdomen that won't go away, or maybe it's a bra fat that won't go away. There's a good chance that losing 20 pounds is going to kind of be lost everywhere rather than just that pocket of fat. So we can always still work on that pocket of fat. You can still keep losing your weight and that pocket of fat will go away while you're losing your weight. Do you offer consultations to see if I'm a candidate? Yes, we do. They are always complimentary. And you definitely need the consultation. You can't just schedule CoolSculpting because it is so customized. And then can you treat multiple areas in one visit? Kind of touch base on that. But we can definitely do that. Like I've had a patient that I was doing like her chin and then also like an abdomen area. So while this was on, we were doing the area on the abdomen. So we can do multiple treatments all in the same day, and it makes it a lot faster. So if there aren't any other questions, please just schedule that consultation. Let us talk to you. Let us assess you. Make sure you're a good candidate. That way we can address any more questions that you have. So thank you so much for joining. I hope you learned a lot, and I look forward, hopefully, to seeing you all.